basically, psychological trauma is a sense of having an emotional scar or maybe a mental scar that affects you or that is caused by going through a very devastating experience and basically not knowing how to deal with that. So sexual trauma can be caused by a couple of things. Some people go through being assaulted, others have to go through maybe an attempt of sexual assault. Some people who get or can carry sexual trauma are people who maybe have relatives who have gone through sexual trauma, or having people who are close to you or getting to know of an event that has a case of a sexual assault or a rape case or a molestation case. Some of the symptoms of sexual assault is, number one, I said, creating a sense of intrusiveness. This sense of intrusiveness basically comes from maybe having intrusive thoughts, having flashbacks, having night terrors, which someone going through the same occasion or the same sexual abuse over and over again in their heads, and having the event reoccurring again and again. Another symptom of having psychological trauma is basically going through something we call arousal or hypervigilance. Some of the symptoms under this are maybe lacking the ability to sleep. Another aspect is being easily startled or getting angry for no apparent reason, having emotional outbursts, and really having a hard time to talk and maybe also explain your emotions. The third aspect that comes with sexual abuse and trauma is having the urgency to avoid all situations that can maybe cause an arousal or that can cause you to be hypervigilant. And in this sense, when we begin to avoid, some people really go towards maybe watching too much movie or having conversations that are maybe not meaningful. Sometimes avoidance comes in a way of not maybe reading a book all the time, or making sure you find a way to block your thoughts and your feelings and not attending to them. Some of the effects of sexual abuse or sexual trauma to the self are basically having an effect with self-guilt or hating yourself for the act that has happened to you, or giving yourself reasons as to why this should have happened to you or this has already happened to you. The other effect of this is sabotaging yourself, and it may also grow into causing depression or anxiety, which have other severe symptoms, which mean maybe lack of sleep, and the lack of sleep going back to the inability to maybe process the thoughts that you have or the feelings that you have that are related to the devious act that has happened to you. Other effects of sexual trauma on relationships are forming new relationships because of the sexual trauma that one may have experienced. Secondly, also maintaining these relationships that have been there before can be very hard because one way or another there is the urgency of trying to sabotage these relationships. Sometimes intimacy becomes very hard because of the event that also occurred due to the sexual assault. So getting close to someone else might be devastating. Finally, it may cause a sense of dependency or an idea of dependency, being too dependent on your relationships or somehow needy all the time. Sexual abuse or being sexually traumatized really makes people become very vulnerable and be prone to being abused over and over again, especially if they haven't healed, and some of the symptoms being dependability, as we mentioned before, can cause them to be assaulted again. So going for therapy and seeking for medication really allows you to heal in a holistic way through either coping and learning new skills, understanding yourself better, understanding the event better, and interpreting the entire dynamic of how the effect of this situation has really affected your life.